Yeah, that's the 1 minute warning already been about 10 seconds ago.
Liz Bates and Adele Merson. Liz Bates of Channel 4 News and Adele Merson of the Evening Express.
Okay, I'll let them know.
Good afternoon, and thank you once again to all of you for taking part in this briefing conference. I want to start with an update on some of the key statistics in relation to COVID-19 in Scotland. As at 9 o'clock this morning, there have been 8,187 positive cases confirmed, an increase of 367 from yesterday's figures. As always, let me be clear that these numbers will be an underestimate. A total of 1,797 patients are in hospital with COVID-19. That is an increase of 4 from yesterday's figures. And a total of 174 people were last night in intensive care with confirmed or suspected cases of COVID-19. And that is a decrease of 8 from the numbers reported yesterday. It is with sadness that I can report that a further 10 cases have been registered of people who had tested positive for COVID-19 who have died. That takes the total number of deaths in Scotland under that measure to 903. Those figures should be treated with some caution. While people can now register death at weekends, we expect that registration numbers will still be relatively low over a weekend, and this should be taken into account when looking at today's figures. And of course, although it is important to know these numbers, we should never think of the number of deaths as simply a statistic. Each death represents an individual whose loss is a source of great sorrow to many, and I want to extend my deepest condolences to all of those who have lost loved ones. As Health Secretary, I also want to once again thank those working in our health and care sector for the incredible work that you do. That thanks is due to all staff, to doctors and nurses, but also to porters, paramedics, cooks, care workers, cleaners, and many others in our health and social care sector. Your work right now is more essential than ever to the health of our country, and all of us owe you a huge debt of gratitude. It remains the case that the best way for all of us to help our health and care workers is to follow public health guidance. So please stay at home unless it is for essential purposes such as exercising once a day or buying food or medicine. When you do go out, stay 2 meters away from any other person and don't meet up with people from other households. And please remember to wash your hands thoroughly and regularly. These restrictions are tough, and they probably seem especially tough on sunny weekends and the more weeks that pass that we do them. But they do continue to be essential. They are the way in which all of us, each one of us, can slow the spread of the virus, protect our NHS, and save lives. There are two issues I want to briefly update you on today. The first is to confirm that a major consignment of personal protective equipment, or PPE, arrived at Prestwick from China yesterday. It included 10 million fluid-resistant face masks, as well as equipment for use in intensive care units and laboratories. This consignment for our work here in Scotland is the latest result of the 24/7 efforts being made by our NHS Scotland Procurement Service, together with other public sector partners, all of it aimed to make sure that health and care workers have the equipment they need. In the last 2 months, we have distributed more than 80 million pieces of PPE to staff in the NHS. At the end of March, we provided 2 months' worth of stock to GPs. 16 million items have been distributed to the social care sector since the PPE helpline for that sector was launched a month ago, building on their own stocks and orders. And this month, we have worked with unions, local government and the care sector to agree updated guidance on PPE for care workers. We're not complacent about the position here. There is a large global demand for this equipment, but we have the supplies of PPE both in stock and on order, and we monitor those supplies constantly. Tomorrow, my officials will also join a regular Four Nations call to discuss the allocation of PPE that has been procured on a four-nation basis, and that which has been brought through donations or has been gifted to the NHS. All of that is in addition to the national procurement exercise we undertake in Scotland, part of which was that shipment from China. And I would repeat that if any health or care worker has concerns about the equipment they are using, they can contact us by email so that the issue can be resolved. That email is monitored closely by ministers, and we act on it as swiftly as we can. The email address to use is covid-19-health-ppe@gov.scot. The second issue I want to update you on is the position in relation to the NHS Louisa Jordan. On the 30th of March, the First Minister announced the construction of the NHS Louisa Jordan as a safeguard in order to support the capacity of the NHS in Scotland. I can confirm that 3 weeks after that announcement, that construction will be completed today, and the NHS Louisa Jordan will stand ready to accept patients from tomorrow. While we remain confident that we will not require it to do that in the immediate future, it is a vitally important part of our planning and assurance that the NHS in Scotland is prepared. The work to deliver the NHS Louisa Jordan at such pace has been a significant effort. It could not have been achieved without all the contractors involved in the planning, construction and equipping of the hospital. They have our very grateful thanks. But we also take this opportunity to thank contractors who continue to work on other NHS Scotland projects. Your continued commitment to deliver is allowing us to ensure quality care for patients in the future. I also want to take this opportunity to thank Jill Young, who has joined us today, for her leadership of the project, and the NHS staff who have come from across NHS Scotland to plan this facility. You are truly an inspiration to all of us. The decision on whether patients need to be admitted to the Louisa Jordan will be reviewed on a regular basis as the data on case numbers continues to come forward. As I've said before, I hope that this facility will not be needed, but it is valuable to have this extra capacity, and I'm grateful to everyone who has helped to deliver the hospital at such speed. Before moving on, I want to say something about reports in the media today of plans for a 3-stage approach to lifting lockdown and to claims that schools may open in the next few weeks. These are not plans that the Scottish Government has seen, and from what we have read, they are not plans we would currently endorse. we have committed to publishing later this week our initial thinking on how Scotland plots our way forward. This will focus on the issues that have to be weighed up and the changes that will be required for society to adapt as safely as possible to the presence of the virus. We confirmed only 3 days ago that the current lockdown remains in place for another 3 weeks. We will use that time to assess the evidence and the options before we make any further decisions. In the meantime, we need people to continue to stay at home, to abide by the rules, to practice social distancing, and to continue to slow the spread of the virus, because it is all of that effort that is securing where we are today. I'll now hand over to the Chief Executive of the NHS Louisa Jordan, Jill Young, and then to Professor Jason Leach, our National Clinical Director.
I am delighted to confirm the excellent progress achieved in just over 2 weeks to design, construct and mobilise the NHS Louisa Jordan Hospital for operational readiness. It's been a real privilege for me to lead the team, and I also wish to thank everyone who's been involved. Although words alone cannot express the immense gratitude I would like to convey to all the construction partners, to the support workers and to the NHS teams from throughout Scotland. Around 800 staff who have worked so hard over the last 2 weeks to ensure delivery of the Louisa Jordan Hospital, whilst never ever forgetting the devastation and heartbreak that this virus has brought to individuals, to patients, to families, to communities and to the economy. But all of those 800 staff have made sure that their expertise, their dedication and hard work has been exceptional and carried out with immense personal pride that they have been able to contribute to establish a fully operational hospital to provide safe, effective and compassionate care for any patients if we are required to do so. A full operational hospital with pharmacy, radiology, laboratory, CT scanners, full patient health records and catering, portering and cleaning, for example. We have the initial 300 beds in place with all the necessary trained workforce, the infection control, the supplies and the equipment to open when we are required. We also have the ability and planning in place to commence the escalation, if required, to the maximum capacity of 1,036 bed bays, which are also now in place. We will continue to train and bring staff over for environmental induction and awareness, because this is like nothing anyone has ever seen in a normal ward environment. In summary, from tomorrow, we are ready and willing to help our NHS colleagues across the country as part of the Scottish Government's overall response to the pandemic, should the need arise for us to do so. Thank you.
Thanks very much, Jill. Professor Leach.
Cabinet Secretary, thank you very much. Let me add my brief thanks to those of you at the Louisa Jordan, particularly my clinical colleagues led by Ian Wallace and Anne Gow as Medical and Nurse Director, who have come forward to help with training, volunteered to help with patient care, and in my little walk through, I saw faces that were smiling and engaged in that process. So thank you to Jill and everybody who has made that possible. I want to make two brief points. The first is one you've heard me say before, and that is, in summary, the National Health Service is open. It is open not just for COVID-19 symptoms. It is open for other illnesses and any fears you may have, whether you have mental health challenges or you have children who are deteriorating because of a disease they perhaps live with every day. And I want to make it particularly clear to parents and carers of children that the NHS remains open for you. You must bring your child to the GP or to the hospital if you're required to do so. Please do not stay back because you are scared or because you think the hospitals are full of this virus. You will be safe if you bring your child to the healthcare system. It leads me on to the second point, which is about visiting. Scotland has a very enviable reputation of being open, and we're one of the first countries in the world to completely open up visiting across all of our hospitals. Unfortunately, and it hurts me when we had to do it, we've had to limit that visiting for obvious reasons because of the safety around this virus. But you will not have to leave your child alone. You will be allowed to stay with your child if your child needs to stay in hospital. So please do not think that when you turn up at A&E, your child will be taken away and you won't be with them. The hospital is safe, and it is safe for you and your child. The other exceptions to the stringent visiting rules are end-of-life care, so you of course can visit your family at the end of life, be it around coronavirus or be it around any other disease. Of course we will do that in a safe way, and we will keep it to an absolute minimum number of people, but people will not die alone in this country. If you're a birthing partner, of course you can visit at the birth of your child. And the fourth exception is those who would become distressed if they didn't see visitors. So perhaps those with dementia or those with learning disabilities. So you can absolutely visit your loved ones in these circumstances. And it hurts me to have to say others can't. So I hope you know that the National Health Service is open for you, and please use it when you need it. And let me finish just by repeating the same messages as the Cabinet Secretary has. We cannot say it often enough. You are literally saving lives by staying at home and simple public health measures like washing your hands. Cabinet Secretary.
Thank you very much. Let's turn now to the journalists who have joined us and take the first question, which is from Katie Hunter of the BBC.
Good afternoon, everyone. I've been told in the last hour or so that a number of face masks were withdrawn from the ambulance service last week. I'm told there were 1863 face masks. I'm just wondering if you can shed any light on if this did indeed happen, and if so, why that was the case, please.
So the 1863 face masks, that particular type of face mask, were found to have too poor a fit ratio for the ambulance service to continue to be able to distribute those safely to paramedics and paramedic ambulance technicians. So that's why they were withdrawn, but additional supplies of a different type, but again, that same important face mask, have been issued in order to ensure that our ambulance personnel have the protective equipment that they need. And the difficulties, if there are any, in terms of the technical specification around that mask, will be picked up with the supplier, with our National Procurement Service, in order to get to the bottom of that. But the most important thing is that where we have a high failure rate in face mask fitting, that we take quick steps in order to withdraw the masks that are giving that problem and reissue a different make of the mask required, so that our staff have the PPE that they need and that it is effective for them. Thanks very much. So Louisa Scott next from the STV.
Good afternoon. The Scottish Government is asking those with issues that work in the healthcare sector around PPE to contact the designated email address. Can I ask how many emails this has received, and what is the response time to these emails? I've been told last week the automated response said 6 days. A consultant at Queen Elizabeth University Hospital said on social media they had no response in 9 days, which I would describe as a swift response. So what are the figures for how quickly these emails and issues are being dealt with and resolved?
So the full analytics on the operation of that email address will be available as early next week as we can make that, which will give you the total number of calls or emails so far, the numbers per day over that period, and the turnaround time from the quickest to the longest, with particular reference to the consultant at Queen Elizabeth University Hospital. We have investigated this, and what happened was that the issue that was raised was acted on very swiftly, but what didn't happen was the response back to that individual, telling him what we had done and how we had ensured that the visors that he was worried about were available in Queen Elizabeth, that all of that was in place. And so we have now written to or emailed that individual to apologise for the fact that we did not go back and explain all the steps that we had taken in order to act on his query and ensure that the visors that he was anxious about were in place in the hospital and available for use. But the analytics on the email address itself, in the detail that I've described, we will make that available publicly as early as possible next week as we can. Next, we have Liz Bates from Channel 4 News.
Mute. Oh, hello. So I have two questions, if you don't mind. First of all, on the lockdown, if it is relaxed in England over the next few weeks, will Scotland go along with that, or are you prepared to deviate from England and the rest of the UK if you think that that is too soon? And also, ultimately, who will make that decision on ending the lockdown? And secondly, on PPE, you have had 10 million masks into Glasgow yesterday, I think, and I just wanted to know how long you expect those to last. And more generally, you have said that you have enough PPE. Can you reassure every health worker that they will get the PPE that they need to keep them safe?
So I'm going to deal with the last question first and then come to the situation in the lockdown, because on the lockdown I also want to turn to Professor Leach if he has anything more he wants to say. On the PPE question, I think I've said before at these briefings that this is truly a 24/7 operation. There are two routes by which we secure PPE through our National Procurement Service. That is firstly through our National Procurement Service, through the supplier network they have, through the work that is underway to test additional offers from suppliers who are not part of that framework, but who are now offering to be suppliers to test the quality of the offer that they're making, due diligence on the company and so on, so that we can add them to that. Those orders that we have put out and constantly are issuing are checked constantly every single day to ensure that the delivery times we've been given are going to be met, that the quantity that we have ordered is going to be met, and if not, how much less of what we have ordered is going to come. So that is a constant operation undertaken by our National Procurement Service, and I am personally very thankful to them for what they are doing, because they also take responsibility for the 4-route distribution that we have introduced, including from this weekend, direct PPE distribution to our care home sector, a week's supply, whilst we try and understand from them exactly what stock they individually in each care home have, as well as the at least week's supply that we are now issuing direct to them this weekend. The second route by which PPE may come is the 4-nation procurement approach. And we have received some stock from that route, but we continue to work with our colleagues in Wales, Northern Ireland and in England to look at what additional 4-nation procurement can be undertaken. But those two routes are quite distinct, as they should be. In terms of the 10 million masks, I can't, off the top of my head, tell you exactly how many weeks we would expect that to last for, but I'm very happy with NSS's help to match demand against that volume that we've got, as well as what we have in stock and the other orders we anticipate, to give you an indication of the number of weeks' supply. At this point, we have a minimum at least of 2 weeks' supply of some PPE items, with orders due to come in being checked, and in other PPE items, a longer number of weeks of supply. But it is, as I've said, in the face of global demand, a constant activity that is overseen by me, but also by other ministers, to make sure that we are as on top of this as we possibly can be. On the question of lockdown, what our First Minister said very clearly last week was that whilst we have, with all of the efforts that you have undertaken as members of the public to obey those rules about staying at home when you go out for those emergency purposes only, to buy food or to secure medicines, or for that once a day exercise, that you maintain that 2 meters of social distancing with anyone else, that you don't meet up with other households, and that we all continue to make sure we are washing our hands as effectively as we can. All of those efforts have begun to indicate that we may be controlling the level of the virus in Scotland. But what is clear is that the virus is not going to go away. We have to then work through how can we balance public safety, public health, continuing to control the virus so that it does not overwhelm our NHS, and we minimise the number of deaths that come from that virus by looking at introducing steps towards normalising our life in a way that it is not normal at this point. The First Minister set out that in the coming week we will publish the overall framework that will set out the kind of criteria that we're looking at, the factors that would be considered, the framework and the evidence that we would look for, and the framework of decision making, so that we are as transparent as possible. But what we will not do is give answers to questions when we don't yet have those answers. I don't think that serves anyone well. Now, inasmuch as that can be done on a four-nation approach, then we will want to do that. We have taken that four-nation approach as best we can from the outset, where that makes sense for our responsibility to the people of Scotland. My responsibility for the health service in Scotland, the First Minister's overall responsibility for the people of Scotland. So we are clear that where we can, we will take that four-nation approach, but we're also clear and will set out as clearly as we can in the coming week the overall approach that we will take towards reaching those decisions, the means by which we will do that, so that people of Scotland understand the approach that we're going to take to plot our way from where we are now to a situation where, with different steps and measures, not least an increase in our testing capacity, so that we can test, trace and isolate, all of that coming together so that we can reach decisions in the relatively near future about the different balance of measures that we will be looking to undertake at that point. Perhaps Professor Leach might want to add to that.
I would only add that the decision makers, the First Minister and the Cabinet Secretary and other Cabinet members, have to absorb, I think, 3 layers of evidence, which is part of my job and Gregor's job, who you've seen on this stage a number of times. That's the global evidence, held really by the World Health Organization, but also as we learn from other countries. We are in touch with other countries. We look what happens to other countries when they release lockdown measures. UK-based advice, in which we are part. So Gregor and I are helping at a UK level to give that advice to all 4 UK countries, and then specific Scottish advice. That's exactly what you would expect us to do. We have Scottish demographics, we have Scottish cities, and we have a Scottish health service. Our health service looks slightly different to the other health services, both in the UK and around the world. So the decision makers get the advice from these 3 sources, and then they make the best decisions for the people of Scotland. And I think that's exactly how it should be, both my job and theirs.
Thanks very much. And now Chris Patton from the Press Association. Chris.
Hi, Health Secretary. Just a quick follow-up to Louise Scott's question on the PPE hotline. How many members of staff are actually monitoring that email address on a daily basis? And do you think that there are staff well enough to be able to provide a prompt response and to follow up on issues that might occur?
Well, my understanding at this point is, so the helpline is monitored from first thing in the morning until late at night. My ministerial colleagues are also checking it over that time, and at times I have seen their responses much later than late at night in order to act on issues that are being raised from the email address. There have been no issues raised in terms of staffing, and of course we have to be sure that our staffing of all of these issues, not only the email address but other areas of work that are being undertaken, are as resilient as possible. When we have those analytics that I described earlier in response to Louise, then part of that will also be whether or not from my most senior officials there is advice about increasing the level of staffing, or whether their assessment is that the level of staffing is sufficient at this point. We have increased staffing levels across our health directorate here in government to make sure that we can undertake all of the areas of work that need to be undertaken. But if we do need to increase staffing, then we will do that. Next, we have Simon Johnson from The Telegraph.
Hi, Health Secretary. You said earlier on that you wouldn't consent, the Scottish Government would not consent to the traffic light system outlined in the papers this morning. I just wondered if you could say a bit more explaining that. Is it the principle of a traffic light system or merely the timings that are in the papers this morning of schools opening next month? And could you potentially support a traffic light system at a later date?
So what I said earlier, Simon, was less about whether or not a traffic light system was helpful or not helpful. What I said was that any such plan is not a plan that this Scottish Government has seen, and from the evidence that we have, it is not a plan that we would at this point agree with. I've set out the First Minister's clear statement that she made towards the end of last week about the approach that we will take. I don't think that that approach differs overly much, certainly from what I understand our colleagues in Wales are thinking about. But the important thing is that we set out for the people of Scotland the factors that we will be looking to understand better, the balance of issues that we will be weighing, the criteria that we will use, and importantly, the evidence that we will look to base our decisions on and the framework for those decisions. I think that is important that we do that in the coming weeks, so it is clear as we go through the next 3 weeks of lockdown, exactly that people know how we are working our way through, plotting our route through this so that we continue to keep the virus under control whilst we see whether there are any new steps that we can take to lead us to a more normal way of living in Scotland, whatever that may then end up looking like. But the overriding purpose of all of this is to minimise the impact of the virus on the population of Scotland, minimise the number of deaths from the virus as far as we possibly can, whilst we look at how we deal with the other, as Jason Leach has said, and as the First Minister has acknowledged, the other unintended but consequential harms on people's mental health, on our economy, that we can take steps to see if we can reduce those harms whilst meeting that overriding public health objective. Thank you. Next we have Gina Davidson from the Scotsman. Gina, are you there?
Hi, sorry, can you hear me, Health Secretary?
I can indeed.
Good, thank you. I just wanted to ask, there's been reports in the papers today about the Prime Minister failing to attend 5 COBRA meetings that were discussing preparations for responding to the coronavirus outbreak. Can I ask, was the Scottish Government involved in all those meetings where the Prime Minister was in attendance? And if you were, do you believe that the meetings were still able to plan appropriately, or were there mistakes made and were things not done quickly enough?
So the first meeting of COBRA was on Friday the 24th of January, and I attended that. I recall it particularly well because I was in Inverness with NHS Highland and had to curtail the visit in order to travel south to be part of that first COBRA meeting. And in all the COBRA meetings since, we have attended all of those. And in our own resilience, our Scottish Government resilience meeting, which is chaired by the First Minister. The first of those was stood up on the 29th of January. It remains active, has been chaired by the First Minister, all of those meetings with one exception when it was chaired by the Deputy First Minister. And in all of those with one exception, I have attended all of them as the Health Secretary, and then the exception, 2 Health Ministers attended in my place. So we have taken part in all of those discussions. Of course, as you know, our Chief Medical Officer has been part of the 4 Nations Chief Medical Officer discussions. Our officials have been part of the COBRA official meeting, as well as SCORE meetings where it is officials only in preparation for the ministerial meetings themselves. Others, including Professor Leach, have taken part in comparable four-nation discussions, and indeed, I think you've heard Professor Leach talk before from this platform about the contacts he has made with his colleagues in other countries in Europe, most certainly, and further afield. So we have taken all the steps that we think are necessary. As to whether or not the Prime Minister's attendance at COBRA meetings in the early days made a difference or not, I think many of these issues will be looked at in the fullness of time. Right now, my primary focus is making sure that we do everything we need to do to continue to suppress the virus and to plan and prepare for the steps that we might want to take based on the evidence, based on the clinical and scientific advice that we receive, in order to move to a situation where we find additional ways of controlling the impact of the virus on the population in Scotland. Next, we have Libby Brooks from The Guardian.
Hi, Health Minister. I've had my question dealt with. Thanks very much.
Thank you. Thanks, Libby. Next is Christine Lavelle from The Sun.
Hi, Health Secretary. I wanted to know how many community surveillance tests have been carried out to date? And if you can't say, could you please explain why not?
So I can't give you the exact number, Christine, but I'm very happy to ensure that we do that later on today, if it's at all possible. That, of course, is an important part of the work that we undertake with testing. We are ramping up our testing capacity. We said that we would get to 3,500 by the end of this month. I'm very confident that we will do that, and indeed I have some confidence that we'll go beyond that, all of which, of course, is important as we, for now, but also as we plan and prepare for the steps that might need to be taken over the coming weeks. The community surveillance work, we will provide you with that detail after this briefing. Thank you. Paul Hutchin now from the Daily Record.
Hi there, Cabinet Secretary. Just picking up Simon Johnson's point about the traffic light system that was reported in one of the papers this morning. The paper reported that one of the measures would be long-term social distancing for people who are over 70. That is, that measures would be in place for between 12 and 18 months. Do you think that it's likely that social distancing for that group will be in place over the long term? And I've also got a question for Jason Leach. No doubt you've read the story in the Sunday Times about many of the blunders and missteps made by the UK government and Boris Johnson in the early days of the pandemic. Last month, you said that you would have attended the Stereophonics concert, a concert that was attended by thousands of people. In retrospect, do you think you made a mistake when you said that and sent out the wrong signals?
Thanks very much, Paul. In terms of your first question, one of the things that's important for me to say again is that we will not pretend that we have answers to questions when we don't yet have those answers. And so I'm not going to say yes or no to the question you've just asked me, because as we've set out, in the coming week, we will set out the detail of the criteria and the factors that we will be considering, the process that we'll use for assessing the impact of any one of those, the framework that we will use for reaching decisions as we gather the evidence. All of it with the overriding objective of continuing to control the virus, reducing as far as we can the impact it has on the population of Scotland, including the number of deaths, as we take steps towards introducing measures that return us to more normal ways of living whilst we live with this virus. So at this point, it would be very premature of me to counter and run against what I've just said by answering a particular question about will we or won't we do any particular, take any particular step. We will set that out as we reach these decisions. We will be, as we have been up until now, as transparent as we possibly can. And we take that a step forward next week when we set out the way by which we will undertake reaching those decisions overall for the people of Scotland. Jason.
Well, Paula, I'm the National Clinical Director of the Scottish Government. I would expect that you would think I would follow the guidelines of the Scottish Government, and that's exactly what I have done at every step of this pandemic. The very specific question you ask about the Stereophonics concert, which appears to have become somehow iconic, was on the 11th of March. I didn't go. I'm not a big Stereophonics fan. Some of my family went. It was 12 days before the lockdown. It was in the guidelines. And at that time, mass gatherings were still happening across the United Kingdom. We have to make choices about what interventions we use, and we have to make choices about the timing of those interventions. So I have followed, to the best of my ability, all of the Scottish Government guidelines, and I have done my absolute best to advise the decision makers when they should do the things we've done.
Thank you. Kate Foster now from the Daily Mail. Kate.
Thank you, Health Secretary. I have a question for Professor Leach on COVID infections within hospitals. We understand now that the reinfection rate within the general population in Scotland is less than 1. Do you have an estimate of the rate of reinfection in Scottish hospitals?
We don't know specifically what you describe as what we would call nosocomial infections. That's infections that happen inside institutions. It's a really important thing to know, but we can't know quickly because this virus is so young and we haven't actually got huge numbers of cases in hospitals. But I know that Health Protection Scotland, in consultation with the chief nurse and her team, are working on precisely the answer you seek, because we seek it too. It's also very relevant in care homes. Anywhere where we cohort people together, hospitals and care homes are the obvious examples. So we don't know the transmission rates within them. We do know how to stop the transmission in those institutions, and that's by following very strict infection control guidelines, which we've had in place for years. We've had in place specific ones for this virus for weeks, and I'm confident that those in charge in those institutions are now following them to the absolute best of their ability.
Thank you. Mark McLaughlin from The Times.
Hi there. I'm looking for some of Jason Leach's relentless optimism here, because this morning is probably one of the most depressing mornings I've had in what's been a pretty depressing month, as I've seen pretty much every single strategy that we're going to follow fall. Now, test, trace and isolate seems to be the new plan. Dr. Derek Gatherer, he's Scottish and he teaches at Lancaster University Infectious Diseases. He said COVID-19 isn't really containable. I'm a bit sceptical that test, trace and isolate will help in the case of a virus that spreads through coughing and sneezing and doesn't show symptoms for a week. He said we'll have to try and slow it down while we wait for a vaccine, which still unfortunately looks quite a way off, or we gradually ease ourselves towards herd immunity, which isn't going to be comfortable because many more people will die. Now, on herd immunity, this morning we heard from Professor Gilbert at Oxford University, who said coronavirus doesn't leave a very strong immune memory behind it after recovery. That's why people get infected. So even the nuclear option of herd immunity doesn't even seem like an option according to her. She also said there's no guarantee that we'll get a vaccine, but hopes are high. And on herd immunity, Chris Whitty and Dominic Cummings were both in the Sunday Times today denying that they ever followed this as a strategy. Jason, you said on March 10th, before the Stereophonics gig, that we have got to go for herd immunity. So can you give me any source of optimism that test and trace, herd immunity or a vaccine is going to help us?
Thanks very much, Mark. Before I go to Jason, I have to disagree with you to an extent. You said you started out your question by saying every single strategy that we have followed hasn't worked. I disagree with that. I think everything that the people of Scotland are currently doing in staying at home, only going out for those very distinct purposes about the hours exercise a day, the securing of essential food supplies or medicines, the 2 meters social distancing when you are out, the not having your household meet up with another household, all of that has been effective in suppressing the presence of the virus in our population. Now, that's a fragile place that we are right now, which is why we are continuing that lockdown. But to dismiss those efforts and those attempts, I think, is unfair and wrong. Where we are now is beginning, as I've set out already, to plan and work through and set that out as clearly as we can for the population, how we are going about that, how if we continue to see that flattening of the curve, which you remember was always the objective, if we continue to see the numbers coming through that would give us more confidence in that, what then are the other steps that we need to take in order to control that virus as best we can? Because we have said from the outset, it is going to be with us. It doesn't disappear. Then how can we continue to control that virus whilst taking steps that don't risk another peak, but steps that take us closer to living a normal life across the whole of the population in Scotland? And we don't have the answers to that yet, but we have set out how we are going to go about trying to get those answers and set out that decision making. And part of that is test, trace and isolate. That is part of how we can, it's one of the tools, there isn't a single one that we would use, but it is one of the important tools to use as we plot our way through this next stage. With that said, I'm going to turn to Jason now.
Mark, I have some sympathy for your lack of optimism in the middle of a pandemic. I don't think it's a time of particular optimism. People are dying, people are suffering, families are grieving. What I do have, if you'll forgive me, is I have hope. I have hope that the science, the behavioural science, and the work of thousands will get us out the other end of this. The reason I have that hope is I think we're learning more all the time. The virus science is very young for this virus. We've only had this virus for just over 100 days. It's only existed for 100 days. It feels so hard to believe with everything we've been through as a country and as a world in that time. The WHO this week published its new strategy for how we can help the 194 countries of the world that are members of the WHO get out of this. And one of the elements was test, track and isolate. One of the elements was control the pandemic and make sure you have it controlled to a level where your curve is suppressed to such an extent that you will protect your health system, whether that's in Sweden, Somalia or Scotland, and then begin to think about gradual reduction. Other elements in there talk about engagement with the population, how you would communicate this new world to the population, because behaviour may well have to change for some time to come, and how you would redesign your society for a while to be socially distanced. And you can already see how Scotland has managed that around supermarkets, around some businesses, even in this building we're in just now, which is not used to being socially distanced, is now socially distanced. So I do have hope that the science and the countries who are working so hard at this will get us out the other end. My final point is we of course need the real laboratory science to get us out of it in the end. We need treatments and we need a vaccine. And I don't know how quickly we can get either of them, but I know the world scientists, literally the world scientists, are working on doing that for us.
Thank you very much. Next we have Greg Russell from the National. Greg, are you there? If not, do we have Adele Merson from the Evening Express? I don't think we have either Greg or Adele. So that concludes our questions from journalists for this afternoon. Can I thank all of you for watching? Can I thank Professor Leach for joining me? And can I particularly thank Jill Young, the Chief Executive of the new NHS Louisa Jordan, not only for being here, but for the work and the team that she leads have done so effectively and so impressively to give us that important piece of backup work for our health service in Scotland. Can I end, as we always do, by thanking all of you for all of the efforts that I know you are making, the sacrifices that you are taking. I know how hard it is for grandparents not to see their grandchildren, for daughters and sons not to be able to go and see their mum and dad, for friends not to meet up as we are used to doing and as we enjoy doing. But everything that you do, every day that you do it, is making a difference. So please stay at home. Please only go out for those 3 distinct reasons: that 1 hour a day exercise, to make sure that you can get the food supplies that you need, or to pick up medicines. When you do go out, maintain that social distancing of 2 meters and keep ensuring that your household doesn't meet up with another household. Everything that you do is making a positive difference. You are helping our NHS, you are saving lives, and we could not be more grateful to you for doing it. Thank you very much, and for the rest of your day, have a good Sunday.